According to Remley and Hurley, 2020, personal values guide our choices and behaviors as counselors. Your values are influenced by your upbringing, culture, and even your religious beliefs. Setting aside personal values when working with a client can be a very difficult task for the counseling profession. But this type of practice, setting your personal values aside, is known as bracketing, and it's a very important skill for counselors to have. ACA Ethical Standard A4B outlines how counselors should deal with personal values in their work as a professional counselor. According to the 2014 ACA Code of Ethics, counselors should avoid imposing their own values, attitudes, beliefs, and behaviors. Counselors should respect diversity and use their multicultural competencies in their work. Counselors should also seek training when there is a discriminatory situation, the counselor's values are different than the client's goals, or they risk imposing their own personal values onto the client. According to Grunhaus et al., 2018, the debate on personal values in counseling comes down to the question of unable or unwilling. Unwilling signals an unethical practice because a counselor is refusing to work with someone based on their personal values. An example of this might be if a client comes in to receive some kind of counseling on an abortion situation, and the counselor has some personal value against abortion or a religious belief against abortion, and they automatically refer the client to someone else, or they are unwilling to even start to counsel the client based on their own personal values. If a counselor is unable to counsel because of a competency issue, then a referral could be made ethically, or the counselor can work to gain competence in that area so that they would feel more comfortable working with a client that's out of their skill range. When asked the question about my personal values, I thought about this for a while, and at first I had a little bit of trouble with it because I'm pretty open to diversity, working with people from different cultures, sexual orientations, choices with what you do with your body. I'm very open to that. So I was really trying to think of a personal value that would maybe make me a little uncomfortable. And I think one of them that pops up right away in my mind is anything to do with children being abused, neglected, ignored, like not put first. I think as a mother, that's just how I operate with my kids, that they're put first, they're my priority. So I think anything where I was in a situation where my client was experiencing some kind of issue with that, with their children or something to do with children, I think that would be very hard for me to bracket those personal values about how I feel about children and raising children. And the other one that came to mind was working with clients from a different culture that might have women as being subservient or treated as inferior or abused or neglected in some kind of way. I feel like that might bring forth some personal values of mine that I would probably have to seek some outside guidance with to get a little bit extra help on, so that I wouldn't impose those onto my client. According to Grunhaus et al., 2018, the first thing that should be focused on to avoid imposing personal values on a client is to reflect on your own personal biases, to think about your personal values, how you feel about things, how maybe you would react in a situation. So really taking inventory of that would be the first step. Other suggestions for increasing competency and avoiding values imposition are reading professional literature, supervision with someone who has experience with the different types of clients that you might come across that could give you some guidance and wisdom on that, and also consulting with other peers and attending professional development trainings or events that could help expand your competencies and skill sets. Thank you.